Aspirin can cause some serious side effects. Common symptoms include dizziness, ringing in the ears, and visual disturbance. Serious side effects include gastric irritation and bleeding. Do not take aspirin if you have any gastric ulcer or any bleeding disorder. Aspirin is not recommended for pregnant women or children.
My name is Samantha and I will be talking to you about the contraindications in aspirin and your patient teaching. Aspirin is contraindicated to aspirin and other salicylates. For example, if you are taking magnesium salicylate, it can cause a hypersensitivity, which means it could cause an exaggerated reaction. It could also cause cross-sensitivity with other NSAIDs. Contraindications when taking aspirin are bleeding disorders or thrombocytopenia. In children and adolescents, it can increase the risk of Ray's syndrome with viral infections, meaning children or adolescents who are recovering from, let's say, the flu. They have a metabolic disorder, so it puts them more at risk. So when taking aspirin, you would have to take it with a full glass of water. So after you take aspirin, you have to stay in an upright position 15 to 30 minutes after administration. If you are experiencing any unusual bleeding of the gums, bruising, black tarry stools, or fever that lasts longer than 3 days, it is important that you notify your provider. While taking this medication, you would have to avoid concurrent use of alcohol in order to minimize the possibility of gastric irritation. This medication, it is important that you only take the dose that is prescribed to you. If you double in dose, there is no additional benefits in you doubling in dose, so it is very important that you take the dose that is prescribed to you while taking aspirin.
Inflammatory conditions and thrombolysis, you should try to give aspirin on a scheduled rather than as needed basis. Some are encapsulated and are slowly absorbed and are not exuded for rapid relief of acute pain, fever, or inflammation. They can cause less GI bleeding but may be better suited for long-term therapy, such as arthritis, to give an example. Patients who might not be able to take aspirin via PL might be able to get a rectal suppository. If you are giving a rectal suppository, watch out for irritation and bleeding. Febrile and dehydrated children can develop toxicity rapidly. Monitor elderly patients closely, because they may be more susceptible. Drug irreversibly inhibits platelet aggregation. Stop 5 to 7 days before surgeries, if able. If any aspirin has a strong vinegar-like odor, don't take it.
Produces anesthesia and reduces inflammation and fever by inhibiting the production of prostaglandins. Aspirin also decreases platelet aggression. Therapeutic effects include analgesia, reduction of inflammation, reduction of fever. Side effects of aspirin include rash, urticaria, tendinitis, GI bleeding, dyspepsia, gastric distress, nausea, abdominal pain, anorexia, toxicity, vomiting. Hypersensitivity reactions include anaphylaxis and laryngeal edema.